Hi, the topic today we are going to discuss is grades of piles. So, in the previous video we have seen what is piles. Now we see what are the grades of piles. Everybody knows internal piles, external piles. If it is internal, it's called internal piles. When the piles comes out, it's called external piles. Generally, this is this thing. But as a surgeon, for practical purpose, there are theoretical purpose. There are other grades of piles. And the practical purpose, the surgeon or the gastro surgeon. A patient comes when he diagnoses, he'll always examine, by doing a rectal examination, digital rectal examination, and a proctoscope. These are the minimum requirement to confirm as well as grade or classify the piles. So stage wise, if you see, there are stages 1, 2, 3, 4. Okay, stage 1 is something like when a surgeon examines through a proctoscope, there is a small tube through which you can see internally. So there is the round type of tube. If the pile mass, what we call the pile mass, if it is slightly visible, that's called stage 1. And if it occupies 25% of the tube, occlude the 25% of the tube, then it's called stage 2. 50 is called stage 3, and completely it's called stage 4. Apart from that, we always conclude, add to this bleeding type, stage 1 bleeding type, or even a stage 1 external, or stage 1 with bleeding, along with, these are all classifications. But why we have to stage the disease, these piles? The practical reason, theoretical classification is entirely different. The practical reasons as a surgeons, why we have to classify is, mainly to choose what type of treatment will be exactly good for the patient. Suppose somebody comes with only grade 1 and no symptoms, no pain, no bleeding, then probably we'll say, okay, only diet, exercise. Or some people grade 1 itself, they'll have bleeding, anemia, then we have to do surgery. But some procedure in our surgery, but stage 1, instead of going for a surgery, there are other options like banding. We can put a rubber band so that the pile mass shrinks and the bleeding stops. Or there are certain injections where the blood vessels, the pile mass, what we call, becomes solidified, so the bleeding stops or it shrinks later stages. So these are all non-surgical options like diet and banding, sclerotherapy, all these things. And then suppose there is a grade 3 patient is on blood thinners, or sometimes very old people, even if they don't have any complaints, we urge them to go for a surgery because to prevent any bleeding in the later stage or complications that can happen. Suppose somebody is having cardiac problem or maybe diabetes, hypertension, and stage 3, and they don't have any symptoms, but even then we'll urge them, okay, we can do an elective surgery so that that will prevent the complications. And the stage 4, irrespective of the age, irrespective of the symptoms, we usually urge them for go for the surgery, because one day or the other day they need surgery. They cannot escape from the surgery. And when the whole thing is occluded, that's called the stage 4. We always tell them minimally invasive stapler techniques. There's a painless surgical procedure where they can get complete cure. Otherwise, the stage 4 can prolapse out. Sometimes the rectum, the pile mass comes out. That is external. But very rarely, along with the pile mass, the rectum also can prolapse out. So these are all complications we want to prevent. So stage 4, always we recommend surgery, especially minimally invasive stapler techniques. 3, definitely they will recover surgery, but again it depends upon. 1 and 2, mostly diet or maybe some less invasive, or if there is really disturbing them, they also we do surgery. So these are the stages, we can say clinical stages, usually for the surgeons. Thank you.